past year or so, I've noticed more patients choosing penile inversion vaginoplasty as compared to peritoneal vaginoplasty. And in this video, we're going to discuss why that may be. My name is Dr. Saif Gallagher. I'm a plastic and reconstructive surgeon based in Miami, Florida, with a special interest in gender affirmation surgery. And so let's get into it. So first of all, let's review real quick what penile inversion vaginoplasty versus peritoneal vaginoplasty is. So the difference between the two is how we line that new vagina. So with the penile inversion vaginoplasty, which is still the most common type of procedure done here in the United States and in my practice, what we're doing is lining the new vagina with the anatomy from down below. So typically we're using the scrotal skin to line that deeper part of the new vagina. With the peritoneal vaginoplasty, while I operate from below doing the external anatomy, the urologist comes in from above with the robot through the belly down into the pelvis and creates the deepest part of the vaginoplasty or the new vagina from the peritoneum, which is the inner lining of the belly. And so it's more surgery, it's a little bit more complicated, and potentially whenever we do more surgeries, more things can go wrong. Now, one really interesting thing about working in this community is oftentimes the community is so well connected, they may even be a little bit ahead of the literature. And one theory I have as to why folks may be steering away from peritoneal is that some patients are coming forward with these stories of complications specifically from the peritoneal technique. And there's no doubt, like I said, when we do more surgery, there's more risk involved theoretically. Thankfully, I haven't seen that in my practice, but it is more surgery. We are going into the belly, so there are organs in the belly that could potentially be injured. And so overall, I would say, while it is an extremely safe procedure, if we were to compare the two, the peritoneal probably is riskier because it is more surgery. So I think that's probably the first reason a lot of patients are steering back towards the penile inversion vaginoplasty, is that simply that it's less surgery. The recovery is a little bit easier. With the peritoneal vaginoplasty, usually we can do that surgery through just 3 little incisions on the belly. So really not a big deal, but there is some pain associated with that, and usually it buys my patients 1 or 2 extra days in hospital because of that pain. So that would be the first thing. The second thing is, it's still early days. Not a lot of surgeons offer the peritoneal technique. And so we don't have a ton of data, because data takes a long time to mature and grow and to get the numbers to compare one procedure to the other. My patients tend to be really well educated. They do their homework, and so they're really watching this and oftentimes watching the literature to see, is there a clear benefit of one over the other. There have been some publications showing that there's definitely a benefit in, for example, patients who have been on blockers and haven't gone fully through the puberty and don't have all the tissue development down below. That absolutely makes sense. But as yet, we're seeing not a lot of advantage for the peritoneal over the penile inversion. A lot of patients turn around to me and say, well, what would you do, doc? And it's really such a personal decision. As a surgeon, we tend to be quite cautious because we've seen the worst case scenarios. So I think as a general rule, I would choose the minimum type of surgery. But we do know that peritoneal is safe. It's a good option. We do offer it to patients. From a logistical and practical point of view, it tends to take a lot longer to schedule that, because we need not only me free, but we have to line up our schedule with the urologist and the robot. So just there's a lot of moving parts from that point of view. And it can get very tricky with insurance, especially for folks coming in from out of the country as well, because these become very expensive procedures. So those are just some of the reasons. I think I'm seeing a trend of folks going back to choosing the tried and tested penile inversion technique. Both are absolutely reasonable. We offer both to patients, but I thought I would just make this video as I'm seeing that interesting trend now.